at the New River campus. My name is Amanda Barney, and I'm the Health Sciences Program Coordinator. Next to me, I have our Massage Therapy Program Director, Ms. Van Nostrand.
Hi, thank you so much, Amanda. This is a chance for us to share some information about the massage therapy program, about the profession, and then for folks who are interested in applying to the program, what steps to take so that you can be part of the massage therapy program at TCL.
My job as the Health Sciences Program Coordinator is to work with students to become eligible to apply for the massage therapy program, to know when to apply and how to do so. Ms. Van Nostrand is going to talk about what to expect from the massage therapy program, about the program itself, labs, lectures, and about the clinic sites we have.
Thank you, Amanda. Massage therapy is a fast-growing profession. When we think about the demand for all of the health science professions, massage therapy is growing faster than other healthcare fields. Massage therapy anticipates a 26% increase in hiring as we look from now through 2026. And that compares to a 22% increase for other health science, we might call them assisting professions. So massage therapy is a complementary practice to traditional healthcare. So as we think about the program, and Ms. Barney, let me know if there are any points where you want to join me or if there's anything that you'd like to add as we move forward. The massage therapy program at TCL is a 3-semester program, fall, spring, summer. So we make applications during an initial application period in the first part of the year. Ms. Barney can share more about our specific timeframes and deadlines. Classes start in August in the fall semester and run sequentially, fall, spring, summer, and then there's completion in July, August at the end of 1 year. So a 1-year certificate program. At the end of the program, students sit for their licensing exam, the MBLEX. The massage therapy program at TCL has been here for 15 years, and over the past decade and more, we've had a 100% pass rate for the licensing exam. So students who make their way through the program are extremely successful in meeting their goals and then stepping into employment in the way that they target. So when we think about places we might work, here in our area, the Beaufort County area, the larger service area, extending into Savannah, we have a broad range of employment opportunities. We have spas, we have franchise employers, we have medical practices and chiropractors' offices who now are incorporating massage more and more into their standard treatment offerings for their patients. And even more than that, many individuals who become massage therapists are interested in owning their own businesses and working independently. And that's one of the areas where you have the greatest opportunity for high income. So we can talk some more about that. Ms. Barney, are there things that you'd like to share about the process?
So I would like to have students understand that if you have been accepted to TCL, that does not necessarily mean you've been accepted into the massage therapy program. The massage therapy program is part of the health sciences programs that are on a selected admissions process. So yes, while you might be eligible to apply to the program coming from high school or having previous transfer credits or starting off at TCL brand new, you have to do an application itself to massage therapy. Applications, mirroring what Ms. Van Nostrand said, is once a year, every spring for a fall start. We typically accept around 14 students into our program, and it is a 3-semester program upon acceptance. Information about our applications can be found on our Health Sciences website, and you're also highly encouraged to speak with me as the program coordinator or the program director in order to see if you are eligible to meet that requirement, since we do only have the applications once a year.
Well, in the massage therapy program, we have these 3 semesters. In the first semester, you get a grounding in the science and the basis for our practice. What are the effects on the body? How also do I maintain an ethical practice? So there's both the hands-on that we begin in fall semester, and also the whole process of assessing the client, working with them one-on-one, and developing a treatment plan. It's really worth saying that when you think about how you want your work life to look, there's a question that I usually ask folks who are interested in massage therapy to see if this is a really good fit for them. If you picture the dynamics of your workplace as lots of people and lots of motion and, very intense, kind of setting where you're working maybe on a medical floor or you're doing a variety of invasive procedures or other things, that's fantastic. If you like that dynamic and you're drawn to healthcare, there are specialties that help you, that will fit with that beautifully. Oftentimes, folks who are drawn to massage therapy are folks who get really a lot of satisfaction out of the one-on-one encounter. And massage therapists, sometimes we think about, oh, it's all about the hands. Not at all. Massage therapists, first of all, think about their own health and well-being. So folks who are interested in holistic health are often drawn to massage therapy. We think about how we use our bodies. So if you think almost about a Tai Chi movement, where we're really leveraging the strength of our legs, our lower body, our core, and then leveraging our weight to work into the body of the client and to work with the body of the client, as opposed to on the body of the client. There's a whole approach, a whole mindset that we work through from first semester into second semester, where we deepen our techniques and get into our clinical work, and third semester, in which we actually have a practicum, like an internship, where we partner with our local employers, one student per site, to really have a progression through the program to allow folks who participate to become completely independent, secure, confident massage therapists. Because massage therapists are called therapists for a reason. We need to work with that client who comes to us, assess them for safe practice. Do they need to be referred to another specialist, or does what they need fall within our scope of practice? And then if it does fall within our scope of practice, do we have the various tools and techniques that will let us respond to what they need? And the massage therapy program here at TCL is designed to carry you through those 3 semesters for success, not only in a licensing exam, but actually in practice as an independent licensed massage therapist. For folks who are interested in coming into the program, you might ask, well, what's the schedule like? How are the classes organized? Over those 3 semesters, fall, spring, and summer, we contain a full-time schedule into 3 days per week. So in the fall semester, it's typically Tuesday, Wednesday, Thursday, typically an 8:30 to 5 schedule with some variations, but what you can do is plan for a 3-day per week schedule through all 3 semesters of the program. Ms. Barney and I are here at New River, and the massage therapy program is offered in its entirety here at the New River campus. As we think about your progression through the program, there are going to be wonderful opportunities not just to learn in class, but also to have clinical opportunities. So in fall semester, you're learning all of the basics about how to deliver that full massage and customize it to your individual client. In the spring, one of the days that you're on campus will be a clinical day where you're completing full hour massages and doing all of the documentation and treatment planning that you will need in the real world. When you get to summer semester, you still keep that one clinical day on campus. You have another day that's a business course specific to massage therapy. But the third day during summer semester is actually an internship day. And we have well over 20 existing partners in the community of various kinds and various locations. And we assign one student per employer partner, and the day is the same. It's basically an 8:30 to 4:30 schedule at their site. And the important thing is that if you have in mind a particular setting or a particular employer who's close to you geographically, or you know them, or there are folks you have connections with at that site, our goal is to help you connect with the employer. And if they meet our criteria, I'm glad to work with them and add them as a site. And we do that every year as we work to find the exact match that's going to be best for that student in that internship site. So I hope that gives you a start to an understanding about the semester and the class organization. But I know that this is a lot of information. So I encourage you to contact me, and the links are attached, and also to work with Ms. Barney as you plan and track your way into program.
We just want to say thank you very much for watching our video and your interest into our massage therapy program, and we hope to see you soon.
Thank you. Welcome to our massage therapy lab. This is the space where our students do all of their hands-on work on the New River campus in Bluffton. What you see and what we're working with this morning is one of the first things that massage therapy students learn to do in the process of assessing a client. So behind us we have a really useful tool of a grid. And out of that grid, what we're assessing is the bilateral symmetry of the client. We also will assess our client in a position that's turned to the side, where we're really seeing what kind of a line of posture this particular person is working with. Because what massage therapists are targeting are areas of particular tightness, because that's what our work does. It helps areas that are tight become loose. It's very useful to think about massage therapy as drug-free pain relief. As I look at my client and I assess my client, one of the things that really stands out is the idea that massage therapists are therapists. They're not massage techs. And most of the folks who are coming to us are self-referred. So as I'm considering my client from all angles, and here are students in this lab with all of their classroom activities and with their clinical activities, are working with folks who come to them who they need to assess independently, and then they build a treatment plan. And out of this, we are able to work in a variety of settings. But one of the first and most important things we do is assess the client as they arrive to us. Thanks, Laura. We'll have you turn. Great. Massage therapists work with the bodies of their clients, not on their bodies. And an important piece of entering the space of the client and working with the dynamics of their bodies is assessment. So some of the most important things that happen in massage therapy are quiet and slow, and we spend time in holds that allow us to assess the muscle tone and then compare the muscle tone from one side of the body to the other. And this quiet moment at the beginning of a session is what allows the therapist to adapt the treatment plan from what they put together on paper before the session to the reality of the client on the table. One of the most important things that we learned in the course of the program is proper body mechanics. When the therapist is well aligned and leveraging their body weight out of their core, out of their center, then they can work effectively, and we don't worry about what happens when I do deep tissue work, or how can I work with a variety of clients and their needs, because I'm always working out of my center. In massage therapy, many people think that it's all about hands and hand strength. But really what you see here is a therapist in such good alignment in her own body that she leverages her own center and the work of her legs. So as we move closer and take a look at her hand position, we have a therapist who's taken a sustained hold of the tissues and then come in with the energy of her other hand to hold. And what happens is that we encourage the brain of the client to respond to that pressure, and the release comes from the inside out. Massage therapists work in a variety of settings. So to be prepared for the work that you might do in a rehab facility or other medical facility, massage therapists use tools like the hydrocollator pad. And this is applied to the back of the client so that we can warm the tissues before other work proceeds. The working temperature of hydrocollator packs is 165 degrees. So knowing proper procedures and how to protect the body of the client and work effectively is an important piece of our training.
One thing that I learned that's really, really good with massage therapy is it's not just about helping other people, but you also learn how to help yourself. Because it's so important to know what's wrong with you, because at the end of the day, you can't really help someone else with their pain if you yourself are in pain in the process.
Body mechanics. They're really important in massage therapy because they help you joint stack, and when you joint stack, it keeps you pain-free while providing a drug-free pain relief service to other clients. So throughout an hour-long or more process, you're in different positions, and that can put a lot of wear and tear on your body, and this helps avoid it.
Be patient and trust the process. Don't be too hard on yourself, be good to yourself, and don't take criticism too harshly.
Getting experience from other spas and eventually opening my own practice.
Massage therapy program, most important thing for me was self-care and body mechanics and everything, and how, you know, nutrition plays a big role into, you know, your field as far as this. Like, this is a physically demanding job, and you want to make sure your body is taken care of in the right way, and it'll take you a long way, basically. So